Hello, everyone. My name is Nario Cantu, and thank you for tuning in for the Friendly Pharmacist podcast, starting now. Hey, friends, welcome back to the Friendly Pharmacist podcast. I'm your host, Nario Cantu. Today, we're talking about something that's right at the heart of what we do every single day, pharmacy and public health. You know, that sweet spot where pharmacy practice and community wellness overlap. We're going to dig into how pharmacists are shaping public health through prevention, education, and accessibility. And I'll share a few real-world stories along the way that really bring it to life. So let's jump in. When we think of public health, we usually picture health departments, community clinics, maybe CDC campaigns. But here's the truth. Pharmacies are one of the strongest public health forces in America, and we sometimes forget that. We're in the neighborhoods, open late, no appointment needed. For a lot of people, we're the only healthcare touch point they actually see regularly. That's powerful. Think about it. Every flu shot, every blood pressure check, every refill reminder is public health work. When we prevent illness or help people manage chronic conditions, we're strengthening communities from the ground up. So pharmacy isn't just about filling prescriptions, it's about filling gaps in care. Let's start with the obvious one, prevention. Immunizations have been the gateway for pharmacists to step fully into public health. During flu season, my counter turns into a mini clinic. I'll have families come in, mom's getting a flu shot, the teenage son's due for HPV, dad's behind on his tetanus. We just take care of it all at once. That's how you turn convenience into community impact. And now with point-of-care testing, we're seeing pharmacists detect strep, flu, COVID, even manage diabetes through A1C checks. It's incredible. One of my colleagues started a Blood Pressure Fridays program, free checks, quick counseling, and a standing order with a local clinic. After 3 high readings, the patient got referred directly to primary care. They helped dozens of folks who hadn't seen a doctor in years. That's not just customer service, that's preventive medicine in action. Now, prevention is huge, but what really moves the needle day to day is health promotion. Those little conversations at the counter that change behavior over time. You know what I mean? The 5-second reminders about salt intake, the quick tip about checking your glucose after breakfast, or the encouragement that keeps someone from giving up on their blood pressure meds. One of my favorite tools is something I call the microcoach moment. When someone's picking up lisinopril, I might say, "Hey, how's the salt shaker at home treating you?" It's small talk with purpose. Or when I hand over metformin, I'll ask, "Do you have a working glucose meter at home?" Those little prompts can spark change because they come from a trusted voice, their pharmacist. And we can't forget about adherence, the simplest but most powerful public health intervention. I've seen patients' A1C drop 2 points just from switching to synchronized refills. I've had older patients literally cry when we set up blister packs because it finally made sense for them. These aren't fancy tech solutions. They're human solutions. Now let's talk about some heavier stuff, infectious disease prevention and harm reduction. Pharmacies have played a massive role in HIV prevention through education on PrEP and PEP. Even if you can't prescribe them directly, just explaining what they are. It's a daily pill that prevents HIV, can open the door for someone to take control of their health. And then there's naloxone. Stocking it, displaying it, and talking about it without judgment is one of the most meaningful public health means actions we can take. I remember one pharmacy that put up a tiny sign near the register, "Ask us about naloxone. No judgment, just safety." They had parents, grandparents, even teens quietly asking about it. That's what normalizing looks like. Antimicrobial stewardship also fits in here. Teaching when not to use antibiotics, helping patients understand viral versus bacterial infections, and supporting prescribers when patients push back. When you frame it as protecting antibiotics for when your family really needs them, people get it. Let's zoom in on some specific populations. women's health, pediatrics, and geriatrics. For women, pharmacists can have huge influence, birth control access in states that allow pharmacist prescribing, guidance on prenatal vitamins, flu and Tdap vaccines during pregnancy. These all protect 2 lives at once. For kids and teens, we can champion HPV and meningococcal vaccines and make sure inhaler technique is right. You'd be amazed how many young patients are using their inhalers wrong. One demo can change their whole asthma control. For older adults, deprescribing is a form of harm reduction. We see those Beers criteria meds all the time: anticholinergics, sedatives, unnecessary duplicates. Partnering with prescribers to simplify therapy can literally prevent falls, confusion, and hospitalizations. And if your pharmacy offers BP checks or fall risk screening, that's gold. Now let's talk equity and access, because public health doesn't work if people can't afford care. Every day, pharmacists navigate cost barriers, transportation barriers, language barriers. It's not glamorous, but it's real. I've kept a cost navigator list behind the counter: cheaper alternatives, manufacturer programs, discount resources. Sometimes it's the difference between someone walking away empty-handed or staying on their medication. You can also get creative with accessibility: translation cards, delivery options, and private counseling areas. One pharmacy I know started offering quiet consults for patients with anxiety or hearing issues. Small change, huge difference. Community partnerships matter too. Collaborate with local clinics, churches, or schools. I've seen pharmacies host Saturday BP clinics in church basements, with a local pastor reminding folks to get checked after the service. When the community sees you as a partner, not just a business, that's when you know you've crossed into real public health. Technology is another big piece. Today, even small independents can do population health with a simple pharmacy management system export. Pull your patient list: who's overdue for vaccines, who's refilled late, who's got uncontrolled BP. Then set up a 30-day outreach plan. Text messages like, "Hey Maria, you're due for your refill. Reply Y to refill," or call us. Go a long way. It's proactive care in digital form. And if your state allows collaborative practice agreements, that's where you can really shine. Adjust doses, initiate therapy for hypertension or diabetes, manage contraception. It builds trust and keeps patients within your ecosystem of care. And let's not forget about emergency preparedness, another overlooked public health role. Pharmacies can be lifelines during hurricanes, wildfires, or blackouts. Having backup power for vaccines, keeping an emergency contact list for insulin-dependent patients, or simply educating patients on how to store medications during outages, those things matter. Now, how do you measure success in all this? Keep it simple. Track vaccines given, adherence rates, blood pressures controlled, naloxone distributed, take-back kits handed out. Those numbers tell a story of impact, and they're powerful when you share them with your team or community partners. So if you're wondering how to start, here's an easy 30, 60, 90-day plan. In the first 30 days, pick one service, maybe flu shots, BP checks, or naloxone. Script your workflow, train your team, and run with it. By 60 days, add one more related service, like pairing vaccines with health screenings or adding MedSync to your BP patients. By 90 days, formalize a partnership, a CPA, or a community clinic collaboration, and start tracking your outcomes. Don't wait for the perfect setup, just start. Let me share a few quick stories to wrap this up. There was an older gentleman who kept refilling his granddaughter's albuterol. The pharmacist noticed the pattern, chatted for a minute, and realized secondhand smoke at home was the trigger. That quick talk turned into a quit plan, and a few weeks later, fewer inhaler refills. That's what success looks like. Another one. A guy comes in, confident his blood pressure's fine. The pharmacist offers a quick check. It's sky high. 3 readings later, they fax results to his doctor, and the man later said, you probably saved me from a stroke. That's public health at work. And my favorite, a little pharmacy put a medication take-back bin by the door. Within weeks, people started bringing in bags of expired opioids. Quietly, they made their town safer without a billboard, without a campaign, just consistency and compassion. So yeah, pharmacy and public health aren't separate worlds. They meet at every refill, every conversation, every vaccine. Whether you're an independent pharmacist, a tech, or a chain pharmacist hustling in a busy store, you're part of the public health network, and your impact ripples further than you think. If this episode sparks an idea, tell me about it. What's one public health issue we'll take in your pharmacy this month? Send me a message. I'd love to share your story on a future episode. I'm Nario Cantu, and this has been the Friendly Pharmacist Podcast. Thanks for listening, and as always, keep taking care of your patients, your community, and yourself.